Hello everyone. Today we will be talking about Mid America Pathology Consultants LLC. This is an interview presentation by Michelle Zahid, Louis Nastasi, Elizabeth Johnston, Kevin Pugh, Trevor Wright, and Charlotte Dyer. So, who is Mid America Pathology Consultants? This business is owned by Dr. Kaleem, who is a pathologist in St. Louis, Missouri. He owns two labs. One is Mid America Pathology Consultants and the other is Core Lab Diagnostics. Mid America Pathology Consultants works with larger hospitals around the area who are contracted to send their tissue biopsies to Dr. Kaleem to be read. Dr. Kaleem then sends out diagnostic results within 3 days. The lab consists of a few technicians who prepare the slides to be read, and Dr. Kaleem's wife, who is the VP of Operations. The main tissue types that Dr. Kaleem reads include prostate, gastrointestinal, and bone marrow. We interviewed Dr. Kaleem to learn more about how he manages and improves the quality of his business.
Hi everyone, my name's Charlotte Dyer and I'll be presenting on 2 questions for our group project. My first question is, who's responsible for quality management in the organization? So teamwork is essential for quality management. However, it ultimately falls on Dr. Kaleem to ensure that quality is being kept in the organization. Our next question is, how is quality reported between levels of the organization? Quality depends on the outcome you are trying to achieve. In the case of clinical and medical care, quality care is evaluated by looking at patient outcomes and patient improvement. However, in a pathology lab like Dr. Kaleem's, quality is evaluated on accurate reporting. There needs to be an accurate amount of patient samples for correct and complete reporting. Also, the report needs to be clear and straightforward so that the clinician can be able to read the report effectively and nothing is left to interpretation. This way, the clinician can accurately inform the patient of their diagnosis and the treatment plan. Correcting mistakes is important. When there is a major mistake, it needs to be corrected. There needs to be documentation that there is a correction made and the clinician needs to be notified immediately. Furthermore, there should be documentation that the clinician was notified. However, if it is a minor mistake, the mistake should still be corrected and the report refinalized and released to the physician.
How does your organization identify quality metrics? The quality metrics at Mid America Pathology Consultants are amendment level, turnaround time, and communication timeframe. The first quality metric concerns making the correct diagnosis. If they change the diagnosis based on an error made or a mistake realized, they have to file an amendment. The quality metric is to maintain the amendment level less than 3% of all cases. Turnaround time is another metric. They aim to deliver a biopsy diagnosis and results within less than 3 days of the tissue being submitted to the lab. More than 95% of cases have to be finalized within less than 3 days. Finally, communication must be maintained in a timely manner. Dr. Kaleem must communicate clearly to the clinician any urgent or emergent diagnosis. Emergent diagnoses are communicated within 24 hours of submission of biopsy. They also must be documented in writing. These quality metrics allow Dr. Kaleem to maintain a certain level of organization and quality management.
So, in terms of how his organization improves quality, Dr. Kaleem basically laid out a few sort of guidelines. He says, first and foremost, what they do, they make sure that they are following the protocols and the guidelines that are sort of for best practice. One of the ways that they make sure that they're doing this, they review their metrics monthly. So, they make sure that they're either hitting their metrics or they look at metrics that maybe they haven't been meeting the way they want to. This allows them to either continue to improve a process or reevaluate a process and say, hey, this isn't working. We need to be doing this a little bit better, a little bit differently to ensure that we're meeting the goals that we want to meet. They also consistently reevaluate these metrics just to ensure that what they were doing in the past is still working now. and to still see if there's things that they can do better um, to ensure that they're working efficiently and to sort of satisfy the customer.
Hi, this is Elizabeth, and I'm going to talk about the keys to success and the challenges faced by Mid America Pathology Consultants. So, one of the biggest keys to success in healthcare is being patient centered. To achieve this goal, Dr. Kaleem says their company makes sure that all activities are directed towards improving patient outcomes. As Dr. Kaleem put it, when the patient is put first, that keeps the client happy, bringing him to their second key to success, which is making sure that the clients are happy. Mid America Pathology Consultants is a company that's hired by physicians to help solve their problems, so the client must be satisfied with the work if they are to return for more business. They do so by striving to act as a collaborative team with the physicians and less like a generic service provider. Dr. Kaleem says they work together to solve the problem, which the clients seem to appreciate. The last key to success that Dr. Kaleem mentioned is having continuous quality improvement. A company should always try to improve whenever possible based on the efficiency of the work and the quality of work, with the goal of adapting to changes that improve the company. Dr. Kaleem says that they are constantly striving to improve their metrics in order to be the best company that they can be. The two major challenges faced by Mid America Pathology Consultants are managing personnel and managing processes. In any business, managing people can be difficult. Dr. Kaleem explained the importance of all employees being on the same page, because as a smaller company, it's important to maintain their image in a positive light, and the employees have a huge role in that. Similarly, managing company metrics is also challenging, because it's a continuous, ongoing process. The healthcare field is constantly changing with the advancement of technology and resources available, and at Mid America Pathology Consultants, they constantly strive for improvement with the desire to stay up to date, but this demands a great deal of time and resources from all of their employees.
So the customers for Mid America Pathology Consultants consist of physicians and hospitals. These customers will provide specimens and the lab will provide the reports. And currently, Mid America Pathology Consultants serve 10 clients in Missouri.
What is the level of transparency in reporting metrics to its stakeholders? Dr. Kaleem and his wife Shazia are 50-50 partners in this organization and thus are the stakeholders. Shazia is the VP of Operations and CFO. Because of this, transparency is 100%. They often communicate with each other regarding areas of quality management that may need help and what they can do to fix these issues. The next question we asked was regarding public quality reports. Public quality reports are a way of being transparent in the quality and cost of public healthcare organizations. These reports may help consumers in their decision on which physician or hospital is best suited for them. With that being said, Mid America Pathology Consultants is a privately owned business and thus are not obligated to share these reports. In conclusion, Mid America Pathology Consultants employs quality metrics to improve its services. It's a small business with no public reporting, but there's 100% transparency between Dr. Kaleem and his wife. Ultimately, Dr. Kaleem is responsible for quality management and the success of his business.